Hi, my name is Volker Musahl. I'm at the University of Pittsburgh Medical Center. I have been doing orthopedic sports medicine for the last 25 years. Today, I will be demonstrating soft tissue meniscus allograft transplantation. I like using the all soft tissue technique because it is easy to use, very reproducible, and has excellent fixation. In my practice, I perform meniscus allograft transplantation about 15 to 20 times a year. I choose this procedure for patients with joint line pain, status post meniscectomy, i.e. the post-meniscectomy knee. I don't choose it for instability or for prophylaxis. This is a hemi-plateau with a lateral meniscus still on it, and the way I like it, with the capsule not disrupted. So I mark the junction between the posterior horn and the mid-body, and the mid-body and the anterior horn. I also mark the trajectory of my planned sutures, which are usually between 6 and 8 total. There you go. The specimen we prefer is a fresh frozen allograft, and sizing is done preoperatively with the pull-out method. So on MRI, you measure anterior-posterior, the meniscus, in this case about 38, and medial to lateral, in this case about 36. But that is done preoperatively based on radiograph and MRI. I'm going to make a pretty generous osteotomy. What you have here is you have your posterior root now, and it's still attached on bone. So I have full length. So in my next step, here's the junction between meniscus and capsule. So along it, I will make my incision. Now you can leave a little bit of capsule on if you wish, so it can heal down. But certainly this is your junction of meniscus and capsule. So don't cut into the meniscus if you don't have to. So now this is free. In my next step, and I'm just going to make the sliver a little bit more small. So now I have what I believe is a good meniscus root with a small little sliver of bone still left on it. But I'm going to flip the root around and deliver my suture through it, like so. Step number 2, I'm going through the meniscus horn here. Deliver my suture across. So I have a nice big bite, and I'll test this before I'm done to make sure I feel good about it. Okay. And then number 3, come right. And there you go. Then I'm going to test and make sure I feel good about it. I do. And then I personally mark this blue. So when I have it on the back table, I remember blue is posterior. That's just my personal preference. Now I carry on further with my dissection of the anterior capsule here. Take that all off, and the junction between capsule and meniscus. And then here you can see nicely the anterior root right on the edge of the plateau, and then more medially going right into the ACL insertion. Next, I'm going to do my osteotomes again. Okay, I'm going to turn this around now and start rongering off the rest of my, that's maybe a little bit too much bone. Just a little sliver, so that's the idea. Okay, now come my second suture. Okay, like that. And back out the front. So this is your meniscus transplant. There you go. After the transplant is complete, my patients undergo a rehab protocol in which for 6 weeks they use crutches, no weight bearing. For the first 4 weeks they have 0 to 60 degrees of motion. After 3 months they get an unloader brace of the ipsilateral compartment and no deep bending for the first 6 months. No running for 1 year.